This specific study is for patients with EGFR-mutant non-small cell lung cancer, and it's specifically combining Durvalumab, which is an anti-PD-L1 agent, along with Gefitinib, a tyrosine kinase inhibitor for EGFR. So the study was designed to first understand what the potential toxicities are of this combination, and that was part of a dose escalation phase. And then after the dose escalation phase, when a combination dosage had been determined, there's an expansion phase in two cohorts, one to be where each drug is started simultaneously versus another arm in which patients have a 1-month run-in on Gefitinib prior to adding the immune agent. The primary objective, because this is a phase 1, was specifically to look at any potential toxicity. But in addition to that, we're obviously looking at response rates, looking at progression-free survival, and uniquely in this particular study, biopsies were also built in, pre-treatment biopsies along with on-treatment biopsies, to try to understand whether or not at the molecular level there's any synergy or antagonism between the two compounds. This study is important for lung cancer patients because the current standard of care for patients who have EGFR mutant disease is up front to receive a tyrosine kinase inhibitor. And this has been the case for many years now, but as the new immune therapies are coming on board, the question still arises as to whether or not these patients would benefit from immune agents and whether or not they would benefit in a synergistic way from combination of the agents at the time of diagnosis and initial treatment. This study is still ongoing. We still have another approximately 20 patients to accrue. The current progression-free survival data from this particular study is immature, so we can still expect all of that data along with additional biomarker data to understand the molecular events that are happening.